So hello students, today's topic is dental amalgam. So what is a dental amalgam? So dental amalgam, it is defined as a special type of alloy in which mercury is the main component. So according to Skinner, amalgam is a special type of alloy in which one of its constituent is the mercury. So in the dentistry, it is common to use the term amalgam to mean the dental amalgam. So originally, what the dentists used to do, what they used to do was they used to dispense the alloy particle and the mercury in a mortar and a pestle. So this is a mortar and this is a pestle. So they're going to mix them together with the pestle by a hand. And this process of mixing is known as trituration. So it is mechanical mixing of the alloy particles and the mercury in the mortar. That is the mechanical mixing. So the later on, but the powder was compacted in the form of pellets. So which were dispensed along with the mercury in a reusable capsule. They came in the reusable capsule form, and they were triturated by a power-driven triturator or amalgamator. So this is the amalgamator. So you have to remember this for your image-based question session, that the examiner could ask an image that identify this. So this will represent the amalgamator. So today, the disposable amalgam capsule, they are widely available. Each capsule, they contains a predetermined amount of alloy particles and mercury in a sealed pouch, and the capsule that is sealed to prevent the evaporation of the mercury. Now let us discuss the history related with the amalgam. The first of all that you have to remember for your exam is the amalgam. It was first of all used by Chinese. Right? And in 1826, Mr. Trevue is credited with advocating the first form of amalgam paste in the France. The thing very important that you have to remember for exam is the amalgam was introduced to the USA by the Crocker brothers in 1833. So what they did was they mixed the powdered silver coin with the mercury that expanded on setting. So in order to overcome the expansion problems, the GV Black, they developed a formula for the modern amalgam alloy that contains 67% silver, 27% tin, 5% copper, and 1% of the zinc. So this is all about the history of the amalgam. In 1960, the low copper lathe cut was introduced. And the spherical particles dental alloy, they were introduced by DeMare and Teller. Now let us discuss the classification That is number one, based upon the number of the alloyed metals. Number one, it can be either binary alloy, tertiary alloy, ternary alloy, or quaternary alloy. Binary itself means it contains two alloy metals that are silver and tin. In the ternary means three metal alloys that contain silver, tin, and copper. And if there are four alloy metals, then it is quaternary. That includes the silver, tin, copper, and indium. Now let us discuss the classification that is based upon whether the powder consists of unmixed or admixed alloy. If there are more than one alloy, like we add copper to the basic binary silver tin alloy. So binary means it contains two alloy, silver tin, and here we add a copper to the basic binary alloy. Other classification that could be on the base of shape of the powdered particles. That could be lathe cut. Lathe means irregular, something irregular in shape. So the irregular ranging from spindles to shaving is the lathe cut. Other is the spherical alloys, that are the smooth surface spheres. So these are the spherical one. And other is combination of these two. When we have a combination of these two, then it is known as admixed alloy. The classification according to powder size, that could be micro cut, fine cut, or coarse cut. Now you can get a question in exam that low copper content would have copper content less than, the answer would be less than 4%. Other question that can come in your entrance exam is the high copper content contains more than copper content of 10%. Other classification is according to the addition of the noble metals, that could be platinum, gold, palladium. Now, according to the composition and changes of the successful generation of amalgam, it could be either first generation, second generation, third generation, fourth generation, fifth generation, or sixth generation. Now, there was a question in your entrance exam that indium belong to which generation. To find out indium here, it is from the fifth generation. That came in one of the entrance exam. The eutectic alloy, that would come under sixth generation alloy. That is important for your entrance examination point of view. Now, another MCQ that can be asked is, according to presence of zinc, the zinc containing alloy would have zinc concentration of more than 0.01%. So this was another question in your entrance exam, and the non-zinc would contain less than 0.01% of zinc. So what would be the concentration of non-zinc? It would be less than 0.01%, whereas zinc containing would have zinc concentration of 0.01%. Now let us discuss the indication of the amalgam. So where we use amalgam? Amalgam we generally use in class 1 and class 2 cavities. That is the cavities that are moderate to large restoration, that need moderate to large restoration. We gave these restoration that are not in highly aesthetic area of the mouth. or the most important point is we give amalgam restoration that have to bear heavy occlusional load. So it is the property of the amalgam that it can bear heavy occlusional load. It can be given in restoration that cannot be well isolated, that have a heavy occlusal contact, that can be used for cuspal restoration or used as a dye material, or in teeth that act as abutment for removable appliances. So these are the indication of the amalgam. Other cases where we can give is in class 3 cavities. Here in the class 3 cavities, as you can see in the unaesthetic areas, that is in the distal side of the canine, we can give, remember, we can give that in the areas that are not in highly aesthetic area of the mouth. So we choose in the distal aspect of the canine. That is very important for your exam point of view. So the preparation is extensive with minimal facial involvement. So there is minimal facial involvement. Other indication, it can be used in the class 5 in the non-aesthetic areas when the access is limited and moisture control is difficult, and the areas that are significant deep gingivally. So we can give the amalgam in such cases. The contraindication of amalgam, it is not used in the anterior region where aesthetic is a prime concern. In the aesthetically prominent areas of the posterior teeth, or small to moderate class 1 restoration that can be well isolated. So that is important for your exam. And small class 6 restoration, we don't use amalgam. Now coming to the advantages, it is easy to use, easy to manipulate, it is inexpensive, it has excellent wear resistance. So the important point, important property of amalgam is it has excellent wear resistance. Restoration that can be complete in a single sitting without much chair side time. So remember, amalgam has good compressive strength. So that is why it can be used in restoration that have heavy occlusal load. So that is what you have to remember for your exam point of view. Advantages, the sealing ability improves with the age. So remember, the amalgam sealing property improves with the age. Why? Because of formation of the corrosion products at the tooth amalgam interface. So remember this for your exam. The sealing ability improves due to formation of the corrosion products at the tooth amalgam interface. The bonded amalgams, they have bonding benefits. There is less micro leakage, increased strength of remaining tooth structure, and minimal post-operative sensitivity. Now let us discuss the disadvantages. The disadvantages is it is unnatural in appearance, as it it has metallic appearance and metallic taste, as well as it can give, very important feature is it can give galvanic shock. When the one restoration is of amalgam and the opposite one is either some other, so it can give a galvanic shock. Also, it can tarnish and cause corrosion. There will be discoloration of tooth structure. Most important disadvantage is the mercury toxicity. There is lack of chemical or mechanical adhesion to the tooth structure, increased plaque adhesion. An important feature that has been asked multiple times in your entrance exam is it causes delayed expansion. So we will discuss that in brief in another few minutes. It weakens the tooth structure. Now let us discuss the function of the role of the individual components. The first is the silver. Silver, remember, it is the major element in the reaction. So the major element in the reaction is the silver. So what it will do is it will whiten the alloy. It will increase the strength. So remember, the silver, it contributes to increase strength. It decreases the creep. So it decreases flow and creep of the amalgam. It increases the expansion on setting and offer resistance to tarnish. So it increases the tarnish resistance in the resulting amalgam. Other component is the tin. So what is the function of this tin? It is the second largest component and contributes 1/4 of the amalgam alloy. So remember, the tin, what it will do is it will control the reaction between the silver and mercury. So imagine what would happen without tin. Without tin, you will see the reaction would be very fast, and the setting expansion would be unacceptable. So what the tin would do is it will reduce the strength. It will reduce the expansion and decrease the strength of amalgam. It would increase the flow properties and it will reduce the resistance to tarnish and corrosion. So hence we have to control the tin content. So remember, the tin content should be controlled. Other component is the copper. So what is the function of this copper? It increases the hardness and the strength. It increases the setting expansion. Next important component is the zinc. Remember, in the very small amount, it does not influence the setting reaction or the properties of the amalgam. So zinc, it will act as scavenger of foreign particles. So remember, the zinc act as scavenger or deoxidizer during the manufacture. So what it will do is it will prevent the oxidation of important elements like silver, copper, or tin. So oxidation of these elements would seriously affect the properties of alloy and the amalgam. So remember, the alloys that are without zinc, they are more brittle. So zinc, very important function is it causes a delayed expansion. if the amalgam that is mixed is contaminated with the moisture during the manipulation. So what is delayed expansion? It is gradual expansion of the zinc containing amalgam over a period of weeks to the month. So this expansion is associated with the development of the hydrogen gas that causes incorporation of moisture in the plastic mass. So that is why we prefer zinc free alloys nowadays. Other important component is indium or palladium. So what it do is increase the plasticity and resistance to deformation. So remember, the indium, when added to mercury, it reduces the mercury vapors and improves the wetting. The platinum that hardens the alloy and increase the resistance to corrosion. The indium can also be added to powder. Although it reduces the early strength, it increases the final strength, and it reduces the creep.